Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
analgesia. We have droperidol plus fentanyl is used in neuroleptic analgesia in the ratio of 50 is to 1. Neuroleptic analgesia. In neuroleptic analgesia, we have droperidol plus fentanyl is used in neuroleptic analgesia in the ratio of 50 is to 1. There is neuroleptic anesthesia. In neuroleptic anesthesia, we can use droperidol, fentanyl, and nitrous oxide together. These three are called as neuroleptic anesthesia. Droperidol causes QT prolongation, thus causing torsades D pointers leading to cardiac arrest. Droperidol comes with black box warning.
Neuroleptic analgesia, droperidol and fentanyl are used in the ratio of 50 is to 1 for neuroleptic analgesia. Neuroleptic anesthesia is droperidol, fentanyl and nitrous oxide together. We call it as neuroleptic anesthesia. This droperidol will cause QT prolongation resulting in torsades D pointers, which causes cardiac arrest. So this droperidol will come in black box warning.
thank you and thank you for watching.